A lot of students think, I graduated, I'm done. And guess what? There's way more to do. There's way more to do. And so I think that's a lot of times the big gap, especially if the employer is thinking the student's gonna come out ready to work day one. We get that sometimes, and that's just not a thing. That's just not a thing. A good orientation is gonna be super important for all of these students that are coming out of our program, every program in town, any nursing school really.
Welcome to In Good Company.
I'm Dr. Shannon Williams, and I am the Associate of Science in Nursing Program Coordinator here at the Mercy College of Nursing and Health Sciences. I am in charge of 4 semesters, basically. I make sure everything's kind of running smooth. I do deal a lot with student issues and problems. I also teach in the LPN Paramedic Bridge Program. And then I'm the coordinator of the Salem campus as well, that has a bridge program. So I have a lot of hats.
Where do you see the biggest gaps between classroom learning and clinical practice?
Yeah, so I think one of the biggest gaps is the lack of knowledge of what the student thinks they're going to come out with and what the employer thinks they should have when they get there. Mm-hmm. And so we are working towards a general nurse who is safe. That's what we're looking for. And so once you get out of nursing school, there's a lot more learning to be done. And you know, we just have laid a base. We have just laid a base here. And so anything you do after this is gonna require, you know, some kind of extra learning. You're gonna have to learn where you're going and the area you're working in, the things they do there. And you're gonna have to really not stop learning, I think is the biggest thing. A lot of students think, I graduated, I'm done. And guess what? There's way more to do. There's way more to do. And so I think that's a lot of times the big gap, especially if the employer is thinking the student's gonna come out ready to work day one. We get that sometimes, and that's just not a thing. That's just not a thing. A good orientation is gonna be super important for all of these students that are coming out of our program, every program in town, any nursing school really.
What are the soft skills that you say most college graduates or most nursing graduates lack?
So communication is a big problem. Communication professionalism, how to look people in the eye, how to talk to people, how to write an email that actually has capitalization and punctuation, things like that. And we try to integrate that into our program and require things like, if you're going to email me, you need to do it in this way. So we kind of do things like that. Texting has really messed everybody up with capitalization. Punctuation is weird now. Nobody wants to do that. So, you know, those are some of those things. Empathy is hard to teach, and it has to be started from when you're a small child. I think personally that you need to be able to see how you can help people and what they need from you, and how to work that into your care. And so sometimes that's a real hard one, because it's hard to teach. You can't make somebody empathetic, right, you know, through a classroom activity. We do try, we do put some of that in there. And just communication a lot of times is a big problem. We just try to get everybody to be kind and help each other learn, because it's hard and it's supposed to be hard, right? Yes. You want a nurse who's had to work hard,
yes,
you know, so.
What habits would you suggest students build now to avoid early burnout? Because as you know, burnout is a big thing in the nursing field.
I think the biggest thing is that you can't work every day all the time. And it's in our minds. As a new nurse, I wanted to work, you only work 3 days a week, but they're 12-hour shifts and they're hard, and you are tired and you need to recuperate. So adding on additional shifts thereafter, you're taking away your recuperation time. there's a lot more than just physical work to this. It's mental, it's constantly being needed, is very draining. And so while you want to do a super great, good job, you can't do that 7 days a week. And so I think it's important for people to understand that you can't work yourself into this. You will work yourself out of this job, working that many days. I was a med-surg nurse for 20 years, and the burnout rate for a med-surg floor nurse is very high because it's a lot. There's a lot of patient needs and wants, and you don't always get treated the best. So you have to kind of stand up for yourself. I think that's a really good way to keep from getting burnt out, and not doing things that aren't in your scope of practice. Because that's how we've always done it, et cetera, So I think you have to stand up for yourself some, and I think you have to continue to learn constantly and always take those opportunities, to do extra learning if you can.
Like healthy boundaries.
Yes.
This is my off time.
Yeah.
That's perfect.
I don't do, emails after hours. I don't do, grading after hours, and that's just in this job. And so, when I go home from work when I was a med-surg nurse, I went home from work, right? And you try not to take it with you.
What's the number one quality you really look for, and you say that student is going to be successful or does well, or you know what I mean?
Mm-hmm. I have this thing called, what I like to call, it's a learning attitude. It's somebody who doesn't say, oh, I already do that. I already know that. I know everything. That person's not going to do well, and they won't be safe. I like to have students who listen, but also try to figure things out themselves. But there's a fine line between going too far by yourself and not asking for help. So I always say the most unsafe nurse is the one who does not ask for help. Right. So I think I really like students who are confident, but not, there's also a line there. If you're too confident, nurses won't want to help you learn because they think, oh, they already know it, right? Mm-hmm. So it can be, there's a balance with everything, just like with everything, there's a balance with your attitude. But I love a learning attitude. That's my favorite thing, is a student and I put that in all their paperwork. You have a great learning attitude, mm-hmm. Great learning attitude.
What got you into nursing?
So I had no clue to be a nurse. I was going to be a veterinarian and then my son was born with spina bifida. And he had to be in the hospital for several days after, and he had a really great nurse, and I didn't know what to do with myself. So I was like, oh yeah, let's do that. Now that's not the best way to do it.
Right.
That's definitely not the best way to do it.
Yeah.
But it is a good way. It is a good way to do things. But also having people do, lots of my students have family members who have all been nurses, right? And so it just really depends. But I was like, oh, I think I'll be a nurse. And it worked out. That
Yes.
doesn't always work out.
Yes.
We do get people in who randomly are just like, you know what? I don't think this is what I thought it was going to be. And I'm fine with that, right? I would rather you see it in the beginning before you get too far in and you just can't do it or don't like it or whatever. It's just not your fit. I would much rather see you take that on and go, no, this isn't for me today. Yeah, so.
What type of qualities do you think that program should have to really help them with that position?
I think that we've gotten so far into some orientations now, they're almost reteaching all of nursing school, which isn't necessary, right? What I think they need is to probably be nurtured more than taught at that point. And the critical thinking component takes time. I help you with that in nursing school, but it doesn't just come, right? And so it's seeing these things happen over and over again. And then I go, oh, that's why that's happening. Here's what I should do. And so I think the critical thinking component could be better in orientation. I think they don't need nursing school over again, right? They need to know how to now put it into works with the patients I have here. So we have a good clinical partnership we are lucky that way. But there are many things that a lot of these students will never see before they leave. I've had students who've stuck one person ever with an IV because we just don't do those that much. We don't get the opportunity, especially as students, because they're hard sticks in the hospital. Everybody's a hard stick and they're sick and they don't want people poking at them and practicing on them. And so there are things that they just never get the opportunity to do. Catheters are very rare. NG tubes are very rare now. And so there's some of those kinds of things that I think would be more helpful, like skills. And then definitely those soft skills still, and that critical thinking piece where you know all this stuff, now let's put it into action, So but I do think some nurturing and some how to not do the things, like there is a big gap between NCLEX world, which I have to teach you, right? So you can pass the NCLEX, because that's how we stay open, is you passing the NCLEX. And then they get to the hospital and the nurses are like, that doesn't matter. And so that's a great big gap for me. And I don't know how to fix that. I've been here 20 years. We have not been able to fix that gap. So
we're working on it. Right?
Yeah. So, the NCLEX is changing some, right? But there are just still some things that you're supposed to do as a nurse that we don't do. We work around, And so it's hard to, that's a big gap for me.
Dr. Williams, thank you so much for your time. I sure do appreciate it.
So my name is Chris Barber. I'm going on about 2 years here at SBU as the clinical coordinator. It's kind of one of my roles here. So I work really close with our clinical partners to meet with them, set up our clinical rotations for the students, do all their scheduling, go to the hospital and check on them while they're there for their clinicals. So a lot of my time in that role is spent in the clinical setting with the students.
Can you tell me a little bit about how can students stand out if they all have similar clinical experience?
Sure, yeah, and that's kind of the biggest thing I tell students. We get a lot of requests of, I want to go here and I want to go here. There's only so much we can do, only so much limited spots to send the students. I tell them it's not really about where you're at, especially the majority of our clinicals are all at one hospital. So if you're in the same building, you're going to be seeing a lot of the same nurses. It's really about how you are when you're there for the day. So that's the biggest thing to stand out. We get all the time students come back to us and they're like, I got a job because I had a clinical rotation there and my nurse loved me. I was working hard for her that day. And she went to her supervisor and was like, hey, we need to hire this one when she graduates or when he graduates. So that's the biggest thing that I see. It's all about every time you're there for a clinical rotation, it's really a job interview for you. If you're constantly engaged, you're on the floor, you're helping the staff, the nurses, the PCAs, they're going to notice that kind of thing. If you are there and make their day easier, they recognize that, and they let their charge nurses know, they let their clin soups know, they let their managers know, and that's really the best way to get in front of them. And as far as like I said, it doesn't really matter what department you're in, because the managers, all the nurses, a lot of times you're working with float nurses, they all talk to each other. And so if you're there in every department you go to, you're putting on a good performance that day, they're going to notice that. On the flip side, they're also going to notice if you're there and you go back and you're hiding in the classroom, working on paperwork all day, and you're on your phone and you're not looking for opportunities, they're going to notice that as well. And kind of on the flip side, what I tell students as well, as far as wanting to see different areas, I know that many times the students, they've made up their mind, I want to work here. But it can also be a good opportunity to go see places that you're not sure if you want to work there. Like on the flip side, like I said, it can be a interview for the student. It also is kind of an interview for the student seeing the area. They can see, I really like the staff here, this is a place I'd like to work, or vice versa, maybe it's a place I wouldn't like to work that I thought I would. So just really my advice would be take in as much as you can with that, with your clinical experiences, kind of notice everything, talk to the nurses, talk to the staff, and just give your 100% whenever you're there, because it very much goes noticed.
what advice would you have for them when finding that first job?
My advice with that is, in a sense, be patient. So a lot of times, kind of like I mentioned on the last question, students have this idea, this is where I'm going to work. And what they want to do as soon as they graduate is jump straight to that. They want their day shift straight in that department, wherever it is that they want to go. My advice with that, in nursing and PT, nursing, I would say even more specifically, there are so many jobs available. If you start somewhere, even if it might not be your absolute dream department you want to be in, same thing, you go in and you impress those employers and you impress your coworkers. Eventually a position's going to open up in the department you want to go to, and you can work your way there. Sometimes it might take a couple years, sometimes it might happen pretty quickly, but I would say be patient. You just graduated, you've got years and years ahead of you. Eventually you will be able to get to where you want to be. And then kind of along the lines like you were saying, we've had students that were like, I wanted to work in L&D or mother baby, something along those lines. And they start there and they're like, this is not what I thought it was. Or vice versa, they go somewhere else that they didn't want to be, because that's what was available. And they're like, I love it. I got here. I love the staff. This is where I want to stay forever. So a lot of times you just you get experiences that you never thought you would, and the plans are going to change. Everything changes. So kind of just look for, students really stress out. I see this a lot where they're like, well, I've applied to this department. This is really where I want to go. I want to go to the ER, whatever it is. And they've been offered a job on a med surg floor or ER on the opposite side. And they're stressing out. They're like, well, I don't know if I want to take that role because I want to wait and see if I get the ER job or see if I get the med surg job. And I'm like, you've got a position lined up, just take it. If it's a place that you would like to work, get in there, you'll make a name for yourself. If you're working hard, showing up, doing all the things you're supposed to, eventually you'll be able to transition where you want to, or you might love it and end up staying there. So that's the biggest thing, because the other thing that I've seen a lot, especially with our, we have a lot of speakers come in from different departments, and they'll kind of talk about their journey, or a lot of our academic relations team. A lot of times they start out and they'll say, I started in this department as a nurse and I didn't really want to be there, and then I was there for 15 years and I loved it. Or they come in and they're like, I'm in this role and I never even knew that was a position that could possibly be a thing, and I've been here 20 years now and I love it. So sometimes I know, as a young nurse, you kind of make up your mind and say, this is what I want to do, but just kind of go with the flow, get your start. If you're working hard, you'll end up where you were supposed to be.
What would you say, do you wish that employers understood about nurses or clinicians entering the workforce?
I think the biggest thing would be, some departments are better with this than others. I think the orientation period is really, really important. And there's sometimes I know you're like, I hired this person, I want to get them out there on their own, not necessarily being, working with one of our other staff for a while. Some of the departments are really good, and they're like, you go through all this training, you take a lot of months. Some of them, they want to throw you straight into the fire. And it may be a situation that student has never been in that department before. They've never seen that patient population. We try to get them through a lot of different clinical areas, or maybe they had 1 8-hour day there and that's all they know about it. So they feel nervous, kind of get thrown into the fire. I think that starting period, putting them on a team with a really good nurse for a while, one of your seasoned nurses, is super, super important. And just be patient with them. A lot of them, they come out, especially if it's a place they don't know as well, they're a little timid and nervous, but if you give them that grace to get started, a lot of times they'll settle in, they'll be a great nurse, they figure it out, get their footing, and then you'll end up with one of the best employees that you've had.
Tell me your why. What do you enjoy about what you do?
Yeah, for sure. So kind of like I mentioned in one of the other questions, this is never the job that I pictured being in. It kind of just happened. So basically what my journey is I was going through school and I changed my career path about 3 or 4 times. So that's another thing I would tell students is, if you haven't got it all figured out yet, it's fine. You'll get there. And that's kind of what school is about. So I changed my career path a few times, wasn't quite sure what I was going to do. I was going to go to PT school, worked at a PT clinic, was like, this isn't for me. It just wasn't quite what I thought it was, and I just didn't see myself staying there. So that's another good thing I really recommend to our students is try to get a tech job or a low-level job in whatever area you're wanting to work in so you can see what it's like. So I finished up. By the time I decided that, of course, I was in my last semester before finishing my bachelor's. So I'm like, what do I do now? So I had one of my instructors came up to me and they talked to me about doing my master's. They had a GA program available, so I was able to go through, make some money, get my schooling paid for. So I was like, I'll do it. I'll just get it done, have the degree. Still going through it, not really sure what I wanted to do. In that experience, I was able to teach a physiology lab and a couple other classes. And what I realized more so, it wasn't as much about the health science as it is. I am interested in the health sciences, and that's kind of what all my background is in. But specifically, I just loved working with students. I liked helping to teach them. I liked getting to kind of see them grow throughout a semester, or sometimes in those programs, I had them for a couple semesters. So I realized that's really what I wanted to do. But again, I wasn't sure exactly what I wanted to do with that. So actually, originally I applied here for an admissions role. I was like, I'll get in, I'll be able to work with students that way, do admissions and advising. Did okay on the interview, but they were like, I don't think this is what you're supposed to be doing. Mm-hmm. And then they brought this role to me and I'm like, sounds great. And now I've been here 2 years and I love it and I don't want to do anything else. So sometimes it just kind of happens like that. This is a clinical coordinator. I never considered that one time ever before I had an interview for that job of doing that role. But sometimes if you just kind of keep going, you'll figure out what you want to do, get in front of employers, talk to them, and present yourself well, and eventually something will come for you.
Absolutely.
Yeah.
Absolutely. Thank you so much.
Thank you.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.